Hello, everyone. Welcome to the Humber More Care webinar today. I'm going to get started right away. So this is being recorded should you have anyone that needs to see this afterwards. But just a reminder, this is the Humber More Care webinar for your health insurance. So we're going to get started. I'm going to start the conversation by first saying I do apologize in advance. I'm feeling extremely under the weather today, but I did want to make sure that I still was able to connect with you to ensure that you received all of the information you need as you start in your new school year with Humber. But I am feeling, unfortunately, quite sick. So I'm going to try my best to get through all the important information to you, but I just wanted to just be honest with everyone on here today that I am quite under the weather. So I will be providing to you all of the information that you need to learn. But if you're going to leave with any information today, please just know that there are lots of areas for you to receive help. The website that I will be going through with you today is morecare.ca. So I'm actually just going to write that into the chat, and so that you can see that. So it is www.morecare.ca. This is where you will go for all the information that we're going through today. So I will be assuming most of you are January start students. Welcome and welcome to Humber. So for those of you who are starting in January, all of the coverage dates that we'll be talking about right now is January 1st until August 31st, 2024. That is the current policy year that we are in, and that is the coverage that you will have. It is important for you to know that you are automatically enrolled, and this is a mandatory plan. So there's nothing you need to do. Everything that I'm going through with you today is already set up for you. You just need to make sure you, of course, pay your tuition. But also, please, everyone on this call, please note that you will not be able to download your MoreCare card until the end of this month. Your coverage does absolutely start January 1st, but you will not be able to download your MoreCare card until the end of the month because we're still receiving enrollment files from the institution. So I'm just going to go right into it. We're going to go right into the website, and we're going to go through everything that you need to know. Please hold all questions until the end, and if you have any questions at the end, you can put those into the chat. So this is the website that is morecare.ca. This is where you will start for everything you need. You are, of course, all Humber College students now. So we will go to the Humber International page, and that will bring you right here. So we have both international students and domestic students pages. Of course, we're going to click on international students, and that will bring you to this page. Now, international OHIP alternative, that is your primary coverage. This is everything that you're going to need to go to the doctor's office, the hospital, if you have blood tests, anything along those lines. So international OHIP alternative is pretty much exactly what Ontario citizens have, but we, along with Humber International, have created an OHIP alternative for you to be able to have access to very similar healthcare as Ontario residents. All right, so on to international OHIP alternative, you have $1 million lifetime benefit maximum for the entirety of your time being covered under the Humber More Care plan. This is for treatments of illness or injury with a doctor or physician. It's at hospitals, medical services and devices. There's maternity expenses, which is, has a maximum of $25,000 per childbirth. There's psychiatric hospitalization maximum of $25,000. There is self-inflicted injuries, suicide, and attempted suicide. That's $10,000. Oncology treatment has a maximum of $25,000, and repatriation is $10,000, as well as return home. I always like to make sure everybody understands what the return home benefit means. That is $10,000 to return home if you were to get so severely ill that a doctor deems the only option is for you to return back to your home country. This is unfortunately not a, oh, I really miss my mom or my dad, I want to go back and visit them. This is entirely health related. It is important for you to know that we do have a medical network where you'll be able to use your MoreCare card once you can download it so that you can have direct billing. But should you ever be in a hospital and you require assistance, just give us a call and we'll be able to help you. Absolutely. So you are absolutely covered for anything you might need doctor-wise while you are in Canada. And this is all within Ontario. If we continue on, it'll go into your prescription drug coverage. So you'll see here that there are actually 3 different plans. So the OHIP alternative, there's just one plan that's available for you, but for the health and dental portion of the plan, there are options. So you are all automatically enrolled on the balanced plan, which is what I will be going through with you today, but there is an enhanced dental and an enhanced drug plan option for you as well. You can take a look at what option suits you best. You'll be able to change your plan within the next 43 days, but you can only change that one time as a student in your starting semester. Again, there's no additional cost for it. It's just whatever suits your needs best. You'll notice that there are some differences. So I definitely recommend taking a look in your own time, what will suit your needs best. But for today, you will be on the balanced plan, which is what I will be going through. So prescription drugs, that's anything prescribed by a doctor in Canada. If you have any prescriptions in your home country, you will need to get a Canadian equivalent. So all you'll need to do is go and see a Canadian doctor, a doctor here in Ontario, and they'll be able to give you a Canadian equivalent prescription, and then you'll be able to get that billed. You have $2,000 $2,000 a year for a maximum. Sorry, everyone. Really not doing my best here. I should really go to the doctor myself. So you have $2,000 maximum per benefit year. There is 80% coverage details and a $10.50 dispensing fee cap. So most prescription drugs and medicines are covered. If you have something specific you'd like to ask about, I highly recommend you reach out to our contact center, and I'll show you how you can do that at the end. There is a $500 maximum for oral contraceptives, $500 maximum for insulin supplies. So that's if you have diabetes. And there's also coverage for the Gardasil vaccine. You will simply have to bring your MoreCare card with you to the pharmacy, and then they'll be able to put that through for you automatically. Dental coverage. So under the balance plan, you have $500 maximum. So basic and preventative services is covered at 100%, minor restorative at 75%, extractions at 75%, and everything else at 10%. I know sometimes dental can be a bit confusing, so I highly recommend requesting a quote when you go to the dental office so you're not surprised at whatever you owe out of pocket. Dental as well, you can bring your MoreCare card with you, and then they'll be able to submit the claim on your behalf. All right, extended health care. So this is all your paramedical practitioners. You do have a maximum of $300 each policy year for each type of practitioner. I'm not going to read through every single practitioner, but there are many different options. You'll see here there's a podiatrist, chiropodist, osteopath, registered dietitian, an acupuncturist, naturopath, and chiropractor. So take a look through here. You have lots of paramedical practitioners that are included, all covered to up to $300 maximum. Sorry, people keep coming into the room. So if we keep going on, and I know I'm going through this quite quickly, but there's lots of information to cover. And again, this is all available to you. And I actually think a member of our team is currently on site at North Campus and Lakeshore Campus this week to answer any questions in person. You'll see here for orthopedic supplies is covered. You have 80% coverage for maximum of $1,000 for a clinical psychologist or speech therapist, if recommended by a physician. If you keep scrolling down, you'll see that there is ambulance coverage. Keep in mind that it is covered up to 80%. So you will have to pay additional costs, which is the 20% if you do need to take an ambulance. Of course, if it's an emergency, absolutely take an ambulance. But if you're able to get to a hospital a different way, I highly recommend doing that just so we can save the ambulance for the people in need. So lots of different things covered under extended health, but if we keep scrolling down, you're going to see that there's vision coverage as well. So vision coverage, we have a balanced plan, 100% coverage for an eye exam, up to a maximum of $75, and then $110 maximum towards prescribed lenses and frames. So that's 100% covered up to $75 for eye exam, $110 for lenses, but that's every 24 months. So it's important to know that that's a bit unique compared to the other coverage. Vision coverage is every 2 years, whereas everything else is within the policy year, which, as I said, right now is January 1st, 2024 to August 31st, 2024. But for the vision coverage, if you were to get your eyes checked, let's say today, January 4th, 2024, you will not be covered under the Humber More Care plan until January 4th, 2026. So if you keep scrolling, you will see that you do have accident benefits available to you as well. I really hope no one ever has to need it, but it is good to know that it is there. There is, life insurance within that. There is accidental medical, there's cosmetic disfigurement, family transportation. Again, I really hope that you never have to use this benefit, but it is good for you to be aware of. And it's also good for you to share with your family just so they are aware what coverage is available for you. If you keep scrolling down, you also have travel coverage. So you have travel coverage for trips of up to 180 days, up to $5 million, which is great. So that is any time that you are outside of Ontario or your home country. So the travel coverage is not valid in Ontario or your home country. Everywhere else, it is valid for you. And if you do find yourself in a hospital or a doctor's office outside of Ontario or your home country, please make sure that you call the number on the back of your MoreCare card, or it's right here. Give that number a call, and the insurance company will be able to set up direct billing for you with the hospital. But please make sure you call within 24 hours so that they have time to connect with the hospital before you get billed. Last but not least, enhanced coverage. So there is early arrival coverage. Should you have come to Canada prior to January 1st, to get set up, you would have early arrival coverage for your OHIP alternative coverage 30 days prior to the start date. So that's December 1st. You would have had coverage for the OHIP alternative. So if you did incur any claims from doctor's offices or a hospital, you will be able to submit that for reimbursement now. All right, so that's all of the coverage that you do have available. Now let's go to actually using that coverage. So if you click on the Your Space section, it will bring you here. Make sure you're always within the international student section because it does have separate coverage for you. You do have a look at the travel booklet. So this is a very long, in-depth booklet about your travel coverage. And then you also have the 2023-24 International Insurance Booklet. Again, very in-depth look at your coverage. I always say it's good to take a look at if you're having trouble sleeping. It kind of puts you to sleep, but it's good to have available to you if you would like further information on your coverage details. All of your different claim forms are here on the right, but there are two most important documents here on the right. One is the International Health Claim Form, as well as the instructions. So if you click here on the instructions, it'll walk you through how to actually fill out your claim form. Excuse me. And then if you click here, the International Health Claim Form, this is the claim form which you will submit for reimbursement. It's all fillable. And as I said, there is that wonderful document available for you to be able to read, to seek assistance on how you are able to submit your claims. We, of course, have a contact center that you can reach out to should you have any questions. And at the end, I will show you how to reach out to them. So if you keep scrolling down, you're going to see student medical card. As I said at the beginning, and I would like to reiterate myself here, is that you can only generate your medical card at the end of the month. So if you are a January start student, please do not be concerned if you cannot generate your card today. You are covered as of as of January 1st, but we are still receiving enrollment files, so you will not be able to download it until the end of the month. All right, keep scrolling down here. We have a wonderful practitioner discount network. This is if you want any additional discounts. You don't have to go to these locations, but it is good to know if you want to save some extra money. I always enjoy saving money, so why not take a look there? Keep scrolling down here as well. We have a provider map. So there is direct billing available for you at hospitals, clinics, labs, and diagnostic imaging centers. You can take a look towards your campus and see what is closest to where you're living. We do have direct billing at many hospitals and clinics around both Humber campuses, including the Humber Health Center. So if you do go to the Humber Health Center, there is direct billing already there. So you will just have to give them your student number and they will be able to put through your claims for you on your behalf. Keep scrolling down. There's some coupons. Who doesn't like to save some extra money? So take a look at those offers there. And there's some steps on submitting your claims, a feedback form, most importantly, our phone number. As I said, we do have a contact center. So our contact center is available every day from 8 a.m. to midnight. You can contact us by phone, which is right here. You can contact us by email, which is right here, or you can contact us by chat, which is actually just right here. So you'll just have to put in your email, your name, your student ID, and then you'll begin chat with a real person, I promise, right away. So as I was saying, this is all from January 1st to August 31st, 2024. If you are a new student, you can choose your plan, which means the other options to the plan for the next 43 days, as well as opt in your family. So if you did come here with your family, which is your spouse or children, you have 43 days left to opt them in. You will simply have to select your program, so international student. Then this is the cost for your family, no matter the size. You'll put in your student number, and you'll just have to fill out all this information here, as well as put in your payment. Once that's done, your family will have the exact same coverage you have, and the coverage dates will be the exact same as well. So if we go back to the front page, you're going to also see the phone number here, but you're also going to see something about how to submit your claims online. So if you just click here, it's actually going to let you know what claims you can submit directly onto your e-profile. So there is an e-profile that you can create. It does tell you how to create it here. And the only coverage that you cannot submit here is the OHIP alternative travel and AD&D claims. So all of your, drug and dental and paramedic practitioner claims you can submit online. So this will tell you how to do that. And you'll see, again, it's right here on the front page, e-profile for online claim submissions and how to submit your online claims. If you were to submit your OHIP alternative claims here, they would be declined. So make sure you submit using the form that I showed you earlier. All you have to do is fill that out. It's all fillable, and you would submit it directly to the email on the page. All right, so I know I did kind of just give you lots of information at one time. So I'm going to stop sharing my screen and take any questions that you might have. So just a reminder that this is being recorded, so you will be able to access it through the Humber International YouTube page. Of course, Humber International is always there to help you, but I just want to remind you that we at MoreCare are here to help you as well. So there is a website, of course, that I had put in at the beginning, which is morecare.ca, but there's also an email that you can email, which is help@morecare.ca. And we have a phone number and live chat available too. So I'm just going to take a quick look through the questions that have already been submitted by the chat. Someone said, do I need to register with any GP to access health assistance? So you don't have to register with a doctor. You can access doctors, on campus. You can go to whatever doctor you need to go to. You don't have to register with any specific one. But of course, if you would like to, you're more than welcome to. Someone said, as an international student, am I going to be covered during the full course period until I complete the course? So yes, you would. Right now, we're in the 2023-2024 policy year, which is why it ends on August 31st, 2024. But then it will start again September 1st. You would pay your fees again, just like you pay your tuition again, and you would continue to be covered there until your course is finished. Someone said, where do I submit the form? So all of the information is directly on the form. There's also that really great, document that does advise how you submit claims, but it's just claims@morecare.ca, which is where you submit the forms, but that is all available right on the form. Unfortunately, I can't share the link to this recording myself. You can absolutely access that through Humber International, and as I believe it will be on their page. Someone said, if I do family opt-in, then change my plan, will that change my family member's plan too? Great question. And yes, your family's plan will mirror exactly your plan. So if you choose to change your plan, theirs would change as well. I did answer about how the insurance coverage dates work. So don't worry if you're continuing into fall, which I imagine most are. You would simply go into the new policy year. You would be paying your tuition again, which includes the premium for your health insurance, and your coverage would continue. Someone said, I've been here since September and would like to access dental services. Can I walk into any dental clinic? The answer is very quick, and the answer is yes. Yeah, absolutely. There is a dental clinic on site at Humber as well, if you're interested in that, but you can go anywhere. Someone said, before I buy the glasses frame, should I submit the claim form first? No, you can't submit before you actually take out your what you would be claiming for. So you would need to get your glasses first. There are many places that do direct billing with glasses now, which is great. So you wouldn't be surprised at the end of what you obviously would owe, which is everything addition to $110. But yeah, it's up to you. Bailey Nelson, we do have a partnership with if you want to go there. But you would have to buy the glasses frames with the prescription lenses before you can submit your claims. Someone said, do we need to select a plan immediately in order to be covered or to get our OHIP card? So as I said, you're automatically enrolled. You're automatically on the balanced plan. If you want to change your plan, you can for the next 43 days. But there's nothing you really need to do other than download your MoreCare card near the end of the month, just so that you have it on you. Someone said, I have a husband and 2 kids. Does the fee cover them all? The answer is yes. Someone says, what if my program is a year program? How do I continue insurance policy with you? So we have answered that already. I'd like to just reiterate one last time. If you are continuing in September, you will continue to have insurance coverage. It will just be a new policy year, just like it's a new school year. So you would just be paying your tuition again, you would be paying your insurance premium again, and your coverage would continue in September. We're currently just in the September 1st to August 31st, 2023-2024 policy year. Next year will be the 2024-2025 year. Someone said, do we first make payment and then claim with the receipt? Yes, if you do pay out of pocket, then you would submit after you pay. Someone said that they need help to set up the healthcare insurance. Again, there is nothing to set up. There is nothing to set up. You are automatically enrolled. You automatically have coverage. Of course, if you have individual questions about where to go, where to start, give us a call and we can help walk you through that in finding a doctor or finding a dental office. We can definitely help put you in the right direction, but there's absolutely nothing that you need to do to set up your health insurance. Someone said I have a medical appointment in a few days and asked if they will be covered or not. Yes, you are covered. But as I already mentioned, we are still receiving enrollment lists from the school. So it is possible that you will have to pay out of pocket and then submit for reimbursement. If you are unable to pay out of pocket, I suggest reaching out to the international office and seeing if they can send your enrollment early. But rest assured, you are covered as of January 1st. And all of the claims that you incur, you can submit by the claim form that is on the website. Again, that's morecare.ca. And at the end of this, I'll write that down again. Someone said, what if I'm not continuing in September? That's fine. Everyone's coverage ends August 31st, 2024. Someone said, can I pay insurance for my wife for less time? Unfortunately, the answer is no. The insurance coverage is for the full policy year. Someone said, if we're on a semester break, is the insurance covered? So yeah, if you are not studying in summer, as long as you are on a break, and that's a sanctioned break by the school, absolutely, you're still covered. Someone said, can the physician on campus give us a referral to a specialist doctor? Yes, they absolutely can. I unfortunately cannot answer how long this process takes. That has to do, of course, with the availability of the physician on campus as well as the specialist. But I highly recommend giving the on-campus clinic a call now and then seeing how soon you can access, their services. Sorry, everyone, my phone's ringing in the background. Hopefully you don't hear that. Someone said, when can we expect a mail about printing our health card? So that would be coming from Humber International. would not be coming from our offices, but as I said, near the last week of the month, you'll be able to print out your card. Someone said, how is this insurance different from OHIP? How do they work together? So they do not work together. This is an OHIP alternative, which means it's different from OHIP. It is an alternative because you do not have OHIP as a student here in Ontario. So this is an alternative to OHIP for you. It works very similarly, but that's why you have to print off your MoreCare card, because it is different from OHIP. If you do have any unique circumstances, and maybe you are an international student, but you do have OHIP through maybe your job or maybe your spouse, please reach out to the international office for steps on how to deal with that. And, if you are, I'm seeing there's one about you are admitted as a domestic student. So I would recommend taking a look at what fees you paid for, because it's possible you were not charged for the MoreCare fee if you are a domestic student. Even if you are international, but if you are paying domestic student rates, then I don't imagine you would have been charged for the OHIP alternative portion of the plan, but you would still have the health and dental portion. Someone asked if insurance coverage is limited to Humber campus, and the answer is no, it is absolutely not limited to the Humber campus. That's just very convenient, but you can go anywhere in Canada for your health and dental coverage, and anywhere in Ontario for your hospital and doctor's visits. Someone asked, is there a deadline to opt in a family member? Yes, that is in 43 days. It's all counting down directly on the website. Someone asked, how does the medical care system work here? Very, very big question. Example, are we being allocated with a primary care provider? How does the referral work? Which is walk-inable, and what is the most efficient way to reach a specialist right away? These are all wonderful questions. You are not provided a primary care physician, unfortunately. That goes for even people who are Canadian. So you would have to seek that out yourself. That's why I absolutely recommend going to the on-campus clinics, because they are there available for you. As it refers to referrals, you do have to go see a physician first, and then they would give you a referral. You can go to a walk-in for pretty much anything, but I highly recommend going to doctors versus the hospital for non-emergent issues. And then, of course, you go to a hospital when there is a severe issue that you need urgent care for. If you do have more questions about the Ontario healthcare system, please give us a call, and one of my wonderful colleagues at the contact center can kind of walk you through the best route for you and what you need. All right, lots of questions about where to download the documents. I will put the website once again at the end. All right, I think I've answered all of the questions that have been asked. Someone asked, can my family members who are covered by family opt-in go to the campus clinic? That's a really good question, and I actually do not know the answer to that. I do work for MoreCare, which is the insurance company. I unfortunately do not work on campus. I do not work for the campus clinic. So if you would like to ask that to the campus clinic, I highly recommend reaching out to them. I think that would be a great question to bring up to them and ask them. I do not know if it is just for students or not. Someone said, if a student comes to Canada who is already pregnant, is she still covered by the maternity benefits? Great question, and unfortunately, they are not. You would have to become pregnant on or after your start date. Unfortunately, you would not be covered for maternity benefits if you were already pregnant arriving here in Canada. All right, lots of questions, excellent questions. Thank you so much. I'm just going to type a couple things in the chat again. So morecare.ca, that is the website that I went through today. Go there, click on Humber, click on international students. That's where all the information is. That's where the claim form is. That's where the documents are. That's where our chat service is, our phone number. And again, our email is help@morecare.ca. If you have any, personal questions, please reach out to us there, and we'll be able to help you every day, 8 a.m. to midnight. But of course, email us anytime, and then we will obviously be able to get back to you the next business day. Thank you all so much for joining. I hope you have a wonderful start to the new year. And if this is your first winter in Canada, welcome. And I hope you've got a good winter jacket, but it'll be a lovely season, lots of fun things to do. And we are so excited to having you here in Ontario. Thanks so much, everybody. Oh, and thank you so much for the well wishes. Have a great day.